Today we have our nurse advocate, Christian Evangelista from the American Hospital Association. Our foundation is pushing towards the expansion of telehealth services to connect patients to vital healthcare services through wireless communication and remote monitoring. Every day we continue to spread information to the people of the United States about the benefits of telehealth. Again, thank you, Christian, for working towards this issue, and I'll go ahead now and extend the meeting to Nurse Advocate Christian Evangelista to share with you today what our foundation is striving for.
Thank you. Hello, and also thank you, Congresswoman Dominique, for taking the time to meet with me today. I'm here to tell you about our organization and how it is helping our constituents. The American Hospital Association, also known as the AHA, is made up of almost 5,000 member hospitals, health systems, and other healthcare organizations. The purpose of our foundation is to help improve the health of people from all walks of life and their communities. I'm here to tell you today that the specific ways your office can help our program. In the United States, there are 44 million people who do not have health insurance and another 38 million who have inadequate health insurance. This means that 1/3 of Americans live each day without the comfort of knowing medical care is available for them and their families if and when they should need it. Our work to make sure all individuals reach their highest potential for health is crucial. Our foundation works with people from all demographics and geographic backgrounds, but the issue of accessibility to healthcare that I am presenting today largely affects those living in underserved urban and rural communities. To combat this, American Hospital Association supports the expansion of patient access to give high quality and innovative services through telehealth. Now take the story of Debbie Holzer from the rural community of Anza, California. After suffering a brutal attack which led to the death of her 2 children, Debbie began experiencing panic attacks, anxiety, PTSD, and depression, which, as you can see, are very serious mental illness conditions. She began seeing a therapist regularly, but the closest one available was 1.5 to 2 hours away. The extra stress of arranging transportation, ensuring she arrived on time, and the added financial burden of getting to her appointments prevented her from concentrating on what she was there for in the first place. It got so difficult that she switched providers, and it was then that telehealth was suggested to Debbie. With each session, Debbie opened up. She felt a great increase in her mental health, and through telehealth, Debbie was able to get off from 11 medications that were not helping her get better to only 2 medications. It went from 11 to 2. Through telehealth, she has learned to enjoy life again and heal. She has a cactus garden that now symbolizes her life, and here is an excerpt from her stating, "When it is cold and brutal out there, part of them dies and comes back. Some of them are kind of ugly and wilting, but then there's a beautiful piece that comes out of it." These are the people that our foundation is fighting for, and telehealth has the power to connect millions of people to high quality special care.
That is a very touching and beautiful story. So, from my understanding, telehealth is now available through video conferencing, correct?
Yes.
May we learn more about what your foundation believes to be the next steps to ensure more people have positive health outcomes?
Yes, it is, and there have been recent changes made to Medicare coverage of telehealth. It is hopeful, but more can be done to build on this progress. Specifically, these actions taken by Congress, which include 1. The expansion of Medicare coverage relating to telehealth, which includes getting rid of geographic and setting location requirements so patients outside of rural health areas can benefit from telehealth, like those in urban communities, as previously stated. Also expanding the types of technology that can be used to include remote monitoring and making sure all services that are safe to provide are approved, rather than a small list of approved services. Secondly, Congress can help resolve federal and state legal and regulatory issues that control if and how providers can offer specific telehealth services, including ensuring coverage, payment for providers from public and private payers are being properly reimbursed to invest in new groundbreaking telehealth technologies. And third, to encourage the synchronization of state laws so that credentialing requirements no longer prevent health professionals from providing care between states. And lastly, to improve the FCC's rural health care program by increasing federal investment in broadband internet access for rural communities where 40% of those people lack access to the internet. The American Hospital Association and growing studies are showing that telehealth can increase access to healthcare services while creating cost saving in the long term. Technology is the future of our world, and telehealth can serve as a vital component in the future of our healthcare system. The AHA and the hospital field sincerely appreciate your time today to learn more about telehealth, and we urge the committee to work toward creating a legislative proposal that pushes for the transition to more innovative healthcare systems that reach all of our constituents. Once again, thank you for your leadership and the opportunity to provide input on this critical policy issue.